Hi everyone, my name is Mary Tam. I'm a registered massage therapist and a structural integrationist. The reason why John asked me to talk to all of you is to talk about how muscles and massage kind of go hand in hand with injury prevention and biomechanics. Oftentimes as weightlifters try to increase their weights, there's a lot of compensation patterns. So for example, like a bicep curl, as you want to bring up more weight, you might want to move your shoulder or even bring your head forwards. These are compensation patterns we can work on together. Having a therapist that will take a look at your body and kind of review what's going through your body is really important because we can find things that maybe you're not paying attention to. For example, we can figure out if you're not hydrated enough, or even when, again, with a bicep curl, you might be twisting your arm one way or the other. These are things that we can let you know and have your trainer help you out and maybe change your biomechanics and your compensation patterns. Injury prevention, massage can help you increase your range of motion, which is less likely to have a stretch injury. Like if I can already fall into the splits, you're less likely to hurt yourself if you fall into the splits. It's much better to be proactive rather than reactive to your injuries. If we can fix what's going to cause you problems before it happens, that'll be much better. So massage in general will help you have some injury prevention, improved performance, and overall general health and well-being. It's important to see a massage roughly about once a month. Something else that I do is structural integration, which is looking at how your body in space stands. So taking a look at static posture, seeing how gravity affects it, and then trying to align the joints through something that we call fascia, which is like the white translucent sheath underneath raw chicken or the things that encase sausages. So these are things that can pull on your joints, and we want your joint to be right in the middle where it's supposed to be so it can give you the greatest mechanical force when you're moving and lifting. Just doing your fibulari again. Working on the fascia, muscle belly. Doing some nerve work. A more gentle technique to release the nerve heading to the muscle belly.
What are you working on now, Mary?
Fibulari muscle, your lateral chain, trying to free up the ankle range of motion. We are working teres major minor, a little bit of posterior delt, a little bit of infraspinatus, trying to get more external rotation in your arm and abduction of the GH.